but today it's all of us working together. I want to thank my good friend Tony Gonzalez, who's taken a lead on this, and I certainly look forward to working with him and with all the colleagues. And as I told Brendan, border security is not a Republican or a Democratic issue. It is a issue that affects all Americans. I live on the border. I don't just go visit the border. I actually live there. I lived all my life on the border. So it is something that I understand, along with our friends here. Certainly the men and women in green, the men and women in blue, the other folks. I see them at church. Our kids go to school. See them at the grocery stores. So part of our communities, we need to do everything that we need to do to help them. As my good friend Tony said a few minutes ago, 14 suicides just this in CBP just this year. And again, it's probably it's more than almost any other year that we've had. But unfortunately, this is not a new issue. Between 2007, that is when CBP started taking numbers, tracking suicides, on November 30th of 2022, there's been 149 suicides within the agency. This has prompted members of Congress, like we're doing here today, to not only put resources, but also CBP to get mental health experts across the nation. And again, it's something that we've been working on with the members. I know we got Susie and my good friend Tony. I sit as the vice chair of the Homeland Appropriations, where we added $23 million in FY22, which is last year. And then this year, in the current proposal in Homeland, we added another $23 million that would help us address the behavioral health challenges within CBP. In addition to that, I certainly want to work with Tony and with the other members to make sure that we introduce and pass the legislation. But in the Homeland Appropriations, we also put very specific language along with the $23 million. That is, number one, develop a process to ensure that employees who utilize CBP behavioral health services are not adversely impacted solely because they self-identified a need for behavioral health counseling and seek behavioral health assistance. That is important because a lot of times law enforcement doesn't, you might have a law enforcement officer that's afraid that they might get a low mark on their record because they're asking for help. So that part is going to be very important, where law enforcement is not afraid to go ask for help. We also have put in language to increase the number of local behavioral health professionals that have experience providing psychological support services to law enforcement personnel. If the federal government doesn't have those experts, then they need to work with local communities to make sure that they get that assistance also. Number three, create a behavioral health curriculum for employees at the beginning of their CBP career to provide resources early and instill the importance of mental health. Again, create periodic management training on crisis intervention to make sure that management can work with the men and women as they need that type of help. And again, improve the existing peer support program and develop a voluntary alcohol treatment program. And again, we're asking that once we pass the omnibus appropriation bill, that within 30 days we will get input from CBP to make sure that we provide that. So money has been put in from last year. We'll put in more money. Language has been put in, but I'm certainly looking forward to work with my good friend Tony Gonzalez and this bipartisan group to make sure that we pass legislation to keep supporting our men and women in green and the men and women in blue also. Thank you so much.
Brandon, Judge. Good to be with you here today.